What do you do when a client is stuck with their shoulders rounded forward and their head forward, but they're not able to move into a more neutral position? In today's episode, I talk with Dr. Anna Hammond, a physical therapist and lead therapist at Core Exercise Solutions, about ways to examine the shoulders and ribs to improve posture and make lasting changes. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. And today I have with us Anna Hammond. Anna is a physical therapist. She is also a certified strength and conditioning coach, and she is co-owner of Core Exercise Solutions with Sarah Duvall. So welcome to the podcast, Anna. Thanks for being here.
Yeah, thanks so much for having me here, Lynn.
All right. Well, today we're going to be talking about pregnancy posture reset. And before we dive into that, though, I just want to let listeners know that we are in the midst of our summit this week. And Anna had a conversation, or Anna had an interview that went live last week in the summit. So if you haven't listened to that, please do so. We'll be talking more about what she covered there in just a little bit. And I also wanted to let you know that we will be having a sale of all of my courses after the summit for 1 week. And then in the beginning of May, I will be launching a new pregnancy course that is designed to work more with baby's positioning in the belly and pelvic pain, or pregnancy pains in the body, and what you should focus on with all the different pain issues that women have during pregnancy. And there's a lot of good stuff in it. What I say to people is that this new course is the techniques are more superficial, thinking our fascial chains and our connections with the muscles and things. And then the holistic treatment of the pregnant body course is a deeper dive into the tissues and structures deeper in the body. So this is going to be, I'm really excited to put this out into the world and get this into your hands, because helping moms get their babies aligned and in a really good position prior to birth is going to be really, really helpful for a smoother birth for them. So plus getting them out of pain. Sometimes the baby's position is creating the pain. So when you can help baby move, mom's pains go away too. So we'll be covering all that in this new course. Just wanted to let you know about that. And so now let's dive in, Anna. What do we need to know about pregnancy posture reset? Where are we focusing today?
Yeah, so as you noticed, baby makes changes into the pregnant body, right?
Yep.
And so in the talk that I gave for the Birth Summit, we talk a bit about kind of spinal movement and pelvis movement and positioning, and how that can help alleviate discomforts in the body, as well as help set up the core, pelvic floor, and diaphragm to function as optimally as possible as we can while we have a progressively growing belly. And then we can think about what I didn't touch on as much in the call, is thinking about scapular movement and position, because this also plays a big factor into how we hold ourselves and what's happening in the rest of our body. We can also think about how, addressing this as much as we can during pregnancy is then going to help set us up for the most success after pregnancy. So we think about how, okay, postpartum, we're already going to be in more of this position, right? With whatever type of feeding we are doing, we're carrying, we're holding
Yeah.
that forward rounded. If you have pain or discomfort from C-section and all that kind of stuff, it's going to pull everything forwards. So then we can think about how that's not only going to affect the shoulder and the neck, but also create more pressure down into the abs and the pelvic floor.
Yes.
Then what I end up seeing is we get stuck in this kind of like yo-yo position where we're either thinking, okay, oh no, I'm down like this. And so then you say, oh, I need to pull my shoulders back. And then everything like flares up and it all is driven from your back instead. We're putting strain on the diastasis, and so then we're just stuck kind of going back and forth. So the idea is thinking about how can we unstick the scapula from the rib cage to help it be able to move independently, restore its full range of motion and movement options. And then that's going to help with that resting posture and position.
Yeah. Oh, so important.
Yeah. And we can think too, and again, it's thinking about the whole kinetic chain, like, the upper body can be a response to what's happening down below, whether that's pelvis position, whether that's falling into a shallow breathing pattern. So we also need to make sure, sometimes it can be easy to see like, oh, this is forward here. But instead of just like hammering up from here, it's like, oh, what about the shoulder blades, the spine, the breathing, the
Yes.
pelvis, the
Yeah.
feet, so still taking into that full body kind of perspective with it.
Yeah. I was shocked. I was working with a chiropractor. He approaches the body, and Don Stout, I had him on my summit years ago. He's just got such a unique perspective on the body. But I was having a lot of getting some radicular pains, and I was doing what we were taught in PT school is that sacral or the cervical shear, to bring the
Hmm.
forward head backwards. And he looked at me, he goes, "Stop that. You're shearing your disc. That's why you're getting your radicular pain." And what I needed actually was more extension at T1 and 2. And so
Hmm.
as I, just focused on bringing my lifting my clavicles up and forward, then my head just rested naturally on my shoulders and I didn't have that forward head posture. So I've really been checking with my clients to make sure they have that good mobility at C7, T1, T2, T3, so that we can get extension in there. And after having a baby, even, we are such a forward folding population with our work on computers and at desks and everything. I say pregnancy creates us to become C's. Our spine is a C shape with taking care of babies. And we really need to make sure we get back into our S curves as we are in our pregnancy and then postpartum as well. So, what are some,
Definitely.
like, what should we be looking at with scapular mobility then?
Yeah, for sure. So one other thing that we'll kind of think about too is like I think about parts being stuck together and being unable to move independently from another. So to touch on what you were talking about of that upper thoracic being in more of a flex posture,
Yeah.
just like I talked about, the scapula can be stuck on the rib cage and not be able to move independently. We can also think of our upper and lower rib cage being stuck and compressed together. So that can come with thinking about like chest gripping, ab gripping. And so again, in order to try to get that shoulder blade to come back, because these parts can't fold or, kind of accordion open, we then end up driving more movement from somewhere else instead
Yeah.
of that isolated movement. So a lot of time what I'll cue people and, just like you were talking about, is I think like there's a hook underneath your collarbone, slightly lifting you up versus thinking about it coming, from that rib area,
Yes. Yeah.
and again, it depends on, I think the other thing, like I was just talking with someone in our courses thinking about like I really like using like a segmental cat cow to assess what is the ability for the entire spine to flex and the entire spine to extend. Along those ideas, we can also look at the pelvis being able to go into a posterior pelvic tilt and anterior pelvic tilt, and scapula being able to retract and protract. And so sometimes it can be really that segmental kind of component where if people are stuck in this area, like if they're a little more, say, extended through here, they're then going to maybe drive from the next place of more mobility and get more flexion down below. So it's almost like you have to reverse it where you're like, oh, let me actually keep this more extended and then bring that part back, and it depends on the individual for where
Yeah.
those
So
nuances are.
yeah, so I just want to say you were talking about the upper T spine, and that when
Yes.
movement can't happen there, that we get more movement in the lower T spine to make that happen. And that
Yep.
in order to get that upper T spine moving, we need to release that anterior, the clavicular upper rib cage area. Okay, just for
Yeah.
the
Yeah. Yeah.
for
For the listeners, not the
yeah,
seers, right?
exactly, right? Like
Yeah.
they can't see you pointing what
Yeah.
part of your
Yeah.
body is. So I just wanted to clear that.
I
Fine.
forgot that part that there's
Yeah,
going to be an
yeah,
audio
right.
component. So my apologies to people.
No worries, no worries. But what we also need to understand as practitioners is that as people are becoming more and more pregnant, they're making more space for baby in there. And especially our clients who are shorter waisted, they tend to get into more of, we'll call it a thoracic extension or rib thrusting forward or rib flare, whatever you want to call that yourself. But that is a very common response to creating more space for baby in the belly. And so what are the implications of that, Sarah, and what can we do to help Why do I keep calling you Sarah?
That's okay. That's
I
okay.
did
People
that.
sometimes
I
be like,
did
you
that
guys
in
look the
the
same. Yeah,
Yeah, you do. I mean, you guys like and well, and they're both short. They're both yeah, I
it's all
apologize.
good. It's
Yeah, that I did
okay.
that to you in the summit interview, but I didn't catch it until I was listening to it later. I went, "Oh my God, I called her Sarah." So I apologize in advance, you
It's okay.
guys. So Anna, what is it that we need to think about with that thoracic extension, rib flaring, posturing for our pregnant clients, and how does that impact the shoulders too?
Yeah, and so we can think about how you're right, like the body has to accommodate, right? And the
Yes.
other reason that we get more of that extension at that thoracolumbar junction, so a lot of time we think about it at the lower rib cage on the backside or like just below the bra line, is that because our abs are more lengthened, we're using our posterior diaphragm and our psoas to stabilize our spine because we can't use those abs as well. And then that is going to affect breathing mechanics and hip mechanics because if the psoas and diaphragm are working to stabilize the spine, they're like, we're busy, we can't do what we're supposed to do,
Yeah.
but then knowing too, like during pregnancy, you can only counterbalance that so much because you have a big beach ball in the way, right?
Yeah.
So you can only bring so much flexion back. So that's where we're trying to encourage as best we can to be like, don't forget, try to flex through that part, try to bring those abs in and ribs back as best you can. And then from a shoulder perspective, we can think about actually the other fun fact too is thinking about that area is, and I talk about this in the Birth Summit talk, is how there are a bunch of nerves that go through there that innervate our abs that are part of our parasympathetic, our autonomic nervous system. So that hypomobility and limited movement at that thoracolumbar junction can really have some effects beyond just like, oh, it feels tight,
Yeah.
kind of a
Well,
thing.
and Anna, you had said there that the abdominal wall is being lengthened, but and most of our clients don't know that they should be keeping their abdominal wall strong during the pregnancy aspect. And I really want to encourage everybody who is participating in the summit to please make sure you check out Taryn Hallam's talk because she does talk about what we should be doing in pregnancy as far as abdominal rehab and then what we need to be doing afterwards as well to help with any diastasis. But that but we should be encouraging our moms to be using their abdominal wall and activating it and keeping it as strong as possible throughout the pregnancy to help keep that balance and get that strain off there. I have to say that that lower rib cage and that diaphragm area, it's always tight
Oh
on
yeah.
pregnant mamas, always tight.
Yeah.
And one side more than the other too, typically.
Hmm.
And so you were talking earlier about the anterior chest and the scapular mobility and stuff, and what it brought to mind for me is the connections of the fascial chains
Yes, 100%.
in our bodies and I talk about this in my new pregnancy course about how the pecs are connected to the recti, which are connected to the adductors, and then so that's that anterior line chain that, if we have shoulder tightness, we also need to be looking at adductors too.
Yeah,
And
it's so fun to feel those fascial connections, either like to your benefit of, I think of it as being like your superpower or like a thing that you can kind of add in and be like, oh, we woke up that other area through these fascial connections. Or on the flip side, thinking about how that tension can create pull. And so you can feel that sensation like, oh, my adductors are tight, but maybe it's because it's getting tugged on, from somewhere else.
exactly. It's not always where the problem is, everybody, or
I
where the
know, right?
pain is. Yeah, yeah.
Yeah, yeah.
But it makes it
Y-
more fun, I
Oh,
find.
for
Yeah.
sure. And that's where I keep joking where I'm like, y'all came here for like this thing, but you're really getting a 10 for one deal, whether you wanted to or not. But then the idea is it's like you're going to be that much stronger, more connected with your body, for then the second chunk of your life or, to be able to move forward and continue to do what you want to do.
Yeah, definitely. Okay, so what do you recommend for the shoulders for helping
Yeah.
our mamas with that area during pregnancy?
Yeah, definitely. So a couple things we can think about. So one, we want to think about the importance of rib cage mobility, breathing mechanics, all that is that the rib cage is the foundation for what the scapula move on,
Uh,
right? So you want to think about how it's a convex surface as the rib cage, so rounded surface, and then a concave scapula that needs to be able to slide around the rib cage. If you think about, I'll often talk about how the rib cage can get dense in it, like a water bottle, or you can get compressed, either squeezed front to back or side to side. So now it's hard for that scapula to make the turn. So people can try to hammer it from the scapula all that they want, but in reality, we can use breath work to kind of puff out the dented parts of the water bottle or compress the parts that are kind of over pushed out to reestablish that, in theoretical, big terms, of a cylinder for that scapula to move on, right?
Okay.
So then we can think about, a lot of time what I'll look at is kind of keeping it simple of how well does the scapula retract, slide back around the rib cage towards the spine, and then protract and slide forward. And again, we're thinking about this being like, I think of it as like going up and over a hill or around a dome versus just like a straight forwards and backwards
Yeah.
movement. And so what we can assess in that is that, okay, as they go to pull their scapula back, can that medial inside border of that scapula slide back equally, or does it get lopsided, right? And
Ah,
so like, say if like the bottom tip goes back faster than the upper tip, we can
yeah.
think about how maybe then when we're pulling back, I need to cue more upper tip to come back. Or from the front side letting go, I need to cue that collarbone area to open up more to slide back, right? And then same thing. Okay, when we go to protract and come forward, can it be like that pocket door, or is it, twisting and tipping as it goes to that movement? We can then think too how a lot of time, again, when people reach restrictions, they're going to get creative to make that movement happen. So I'll find when people go to do that reaching movement, when they run out of space, they'll kind of go gadget arm and kind of like keep going, and then they'll bring their spine with them. And so thinking about how, what is your intention of an exercise, right? So we have rib cage and spinal exercises where we're trying to drive movement from there and restore balance there. Then when it comes to scapula stuff, I'm going to say, don't move your spine and rib cage, only move your scapula. Because if you're trying to move your scapula but moving your rib cage instead, now you've undone maybe some of the like repositioning stuff you did in the other areas. And then you're, oh, I'm actually just using my paraspinals and making them tight all the time. Why do I have to keep releasing my paraspinals, right?
Yeah.
Instead of isolating that movement to the scapula.
Yeah. Oh my gosh. So are you just observing what's happening with that scapula as a person does retraction and protraction of that scapula, seeing if it's staying even or if it's tilting as it does that. And then just focusing in on whatever muscles are not causing it to be even, correct?
Yeah. So a lot of time I'll look at it like, because it's good, you know, just moving your arms forward and backwards without load shows something, right? But sometimes we need to see what happens under load. So that's where, a lot of time I'll use reverse flies or chest flies to see what's happening, because
Uh-huh.
we want to think about how overall it's that same movement pattern of protraction and retraction. You're just choosing if you're loading the front side of the pecs and the serratus, or if you're loading the back side of the scapular retractors. And
Okay.
so by choosing, like the number of times I've seen people where they're in theory supposed to be eccentrically lengthening from their pec, but then they're just pulling back from their shoulder blade muscles. That means that their pec's not actually controlling that movement. And so now when they're in that lengthened position, they're not going to have as much tension to be able to come back out of it. So then they'll get creative to come back
Uh,
out.
okay.
Right. And so you're making sure that, you can still think about, I'm cueing a similar pattern, but I'm going to cue that theme, whether they're doing a serratus work, pec work, scapular retraction work, to help kind of all encompass support that movement and position of the scapula.
Yeah, yeah. I love that. The shoulder is such a suspension bridge in my mind.
Hmm.
Like
Yeah.
it's
Well,
got forward pull, posterior pull, and lateral pull. So it's
yeah, and I think people don't give it enough credit for like what it actually needs to do. And then
right.
to your point about like fascial connections, we can think about how it can connect the upper body through the core to the legs. So that serratus invests into the external obliques to help support that, to help get that cross-body connection of off of one side and onto our other side. Then we also need the scapular retractors that go into the thoracolumbar fascia to support the opposing side pelvis. So I've had people where they're working on hip stuff and they're kind of like at a struggle point, and then we work on shoulder stuff. We didn't change any of their hip things, and they're like, my hips feel better. and you're they're like, damn you
Yeah.
for making me work on another part. Same thing where I've worked on their toes, and they're like, I didn't even change anything in my hips and it feels better. Um,
Wow.
the
Yeah.
other thing I'll talk about too, thinking about like balance of movement. So we can think about like, oh, we want that serratus for, supporting that rib cage and the external obliques. Well, if your scapula are already forward and protracted, your serratus has nowhere else to go, right? So this is this kind of drawer that's stuck analogy of, oh, we need to teach it how to let go, how to get back through that eccentric lengthening of pecs and serratus to get that shoulder blade to slide back and around. Oh, look, now I actually have a better position to move forwards from, right? So it's all about kind of seeing like what movement options people have, what range, part of the range of motion they're missing, and then giving them that half or however much that they're not able to achieve as much to balance out the system.
Okay. Wow. That's so good. That's so good. I'm thinking there's so much more that I need to be looking at than just telling my moms to lay over a ball and stretch out their arms.
Yeah, yeah. I mean, it is such a good starting point. I mean, how many moms are like, "Oh God, that feels so good." It's like what
Right?
you
Yes.
need, kind of a thing. But this is where we're getting, by doing it under eccentric load, we're getting this strength and length. And, thinking too, we're like the number of moms where it's like even recommending for them to be able to do bicep curls, because think about how much your upper body you need to use to hold a baby, to lift a baby, right? And just, from bicep component so that you're not straining in your back or getting pulled forward, right? And so thinking of, and then that has the effects on your pelvic floor. So again, you can try to be like working on stuff in your pelvic floor, but you can think about how can I unload my pelvic floor versus trying to like beef it up, right? Give it a good support team to be able to
Yeah.
make that happen.
Yeah.
The other thing to look out too that I think a lot of people don't think about is again when we think about okay, why is that shoulder forward, right? We talked about how you can use accessory breathing muscles of your pec minor and your neck, and your scalenes if your diaphragm isn't working well. We can think about how maybe you're overusing your pec minor over your serratus with your protraction work. We can think about how you can just have tight chest to begin with, right? We can also think about a lot of time people won't actually access pec major over pec minor. So pec minor is going to do protraction and pull that scapula forward as well as the serratus. Pec major does adduction. So a lot of time, if every time you're pushing, you're kind of hollowing out, right? Instead of getting that squeeze together I was like, I've never actually done this, but for some reason, this analogy works for a lot of people, thinking like you're crushing a can between your boobs, right? To kind of think about that
Get that
muscle
back.
squeezing in,
Yeah.
right? So
Yeah.
not only are you going to beef up those pec muscles, the pec major muscles to help those pec minor not overwork, but then we're also giving better support and tension to then control that eccentric lengthening from to get that scapula to come back.
Wow. All right. That is so cool. I love it.
Yeah, it's so fun. I mean, and this is where it's really helpful. Like, again, I was talking with someone earlier today where they were like, well, I had to dust off my anatomy book after going like through our anatomy section of our course. And it's like, for me, the more that you can visualize the muscle attachments,
Yeah.
understand what each muscle does, the more you can watch people move and be like, huh, I see you driving it a little bit more from here versus from here. Oh, that muscle isn't lengthening as well. And so then that helps us like, yes, we might need to do release work to kind of set the stage. But then if you just go back to reusing that same pattern, you're just kind of digging yourself back into that hole to always have to use that release work.
Yeah. Oh, it's so crazy how much, and I'm noticing this as I get older, and just how much our body can compensate
Oh, it's so good at getting creative and adaptive, which is great until like maybe it reaches
until
a
it's
tipping point.
not.
Yeah.
Right. Oh my gosh. Well, and thank goodness it does all of its compensations during pregnancy,
Oh, for sure. Yeah.
that we can bounce back. I'm going to use that quote because it is the body does have the capacity, and we can really help facilitate that by helping our clients understand their movement patterns and helping them to change to a more balanced approach for their shoulders.
Yeah.
And I think you make such a good point there about the forward rounded shoulders, crunched down position that everybody's doing throughout breastfeeding.
Mm-hmm.
All that is impacting the pelvic floor.
Mm-hmm. Yep. And then we think about because at least we're expanding on being like, oh, there's upper ab gripping that affects the pelvic floor. But, it continues into those
Yeah.
fascial connections and opening up top and just getting that better stack from the upper half of things. Or thinking again, like a lot of time when people are trying to, get heavier into loading squats or deadlifts,
Mhm.
one of the limiting factors can be scapular strength and positioning so that they're not using their back or not, getting pulled forward.
Yeah.
And again, to help support the rib cage and the pelvis.
Wow. Wow. So much to think about. So much to,
Yeah. Well, and a lot of time I think about like as we, explore things, and again, I think a lot of the time it's all about like I think about how we're training the body to make all these different movements and shapes so that you're not overusing one strategy, right? Because if you overuse anything, no matter if it's great or not, you kind of can wear it out, or maybe it reaches its potential of efficiency to do what we want to do. So I think about how by the better that we can move the parts independently, the better that they can work together as a team. And then anytime that I see something where I'm like, oh, I noticed this is happening, like let's see how it goes addressing that. I think I label it as untapped potential, because then it gives you an objective thing to focus on because so much, it's very vulnerable time, right? And a lot of these injuries and discomforts and stuff feel very personal. And so, we can even get to the into the psychology of like, oh, does that contribute even
oh,
more to this like
yes.
protective, kind of
Yes.
component to it? And
Yes.
so kind of in a sense trying to remove the emotion from it and get objective and be like, oh, we're going to work on your shoulder blade moving, but here is something that I can directly address and work on and put my energy towards versus maybe what I'm feeling, prolapse or something, it's like that's
Yeah.
going to take longer to change and make effects on.
Well, well, Anna, I do want to dive in there because I find this so important is that that rounded shoulders, that crunched forward, sometimes it's people protecting their hearts.
Yep, exactly. I think of these as heart openers, right?
Yes, yeah. And so they're in this protective, they're protecting their heart. And what I find is especially I really believe the body's meant to move with ease and grace. and
Hmm.
and that we shouldn't have to over effort to make something happen, and that if we are, there's something deeper going on that is causing the muscles to be that way, and when we can address that deeper issue at play, then things can move with ease and grace. i had i,
Yep.
I had a she was pregnant. Yeah, she was pregnant again, and she was doing, at the end of a session, we happened to notice, I'm like, oh my gosh, you're really doing the rib thrusting, you're into thoracic extension. So I, just talked to her about trying to stack her ribs. And I'm like, okay, work on that. And then she emails me a couple days later and she says, Lynn, that is just so hard. I cannot not thrust my ribs like that. And I was just like, okay, stop. Let's have another session. And then we were able to dive into the trauma of her second birth, her previous birth. And so
Mm-hmm.
it was a fight or flight reaction in her body
Yep.
that was causing this response. And after we cleared that off, she just stood up and she wasn't in that extension phase anymore. Like she was
Yep.
more relaxed. So I just want to share that with people listening in to help them understand that if your clients are really struggling and they're really having a hard time doing the exercise that you're wanting them to do, we may need to dive deeper into or have them go work with someone who can dive into the psyche of what's really being held in those tissues. Because once they do, then it just releases and it's so much easier.
Yeah, I think about it as like working smarter and not harder, right? And so we
Yes.
can think about like a lot of time when people have, I think it was Diane Lee maybe that talks about like the power of when we're addressing muscles that are gripping for protection, for strategy, stabilizing,
Uh-huh.
adding in the visualization component of melting, softening,
Mm.
peeling away, can make a really big effect to get that tissue to let go versus if you're like attacking it, it's going to rebound and recoil and be like, oh no, we got to double down on this like hold down
Yeah.
situation, right? And
Yeah.
then we can also think like again with some of these isolated movements that maybe aren't as big of movements, I think of it as knocking rust off of that spot and kind of giving it a little bit WD-40 so that when we go to, like, oh, let's like bring a little bit of active pull back in that position for the ribs. It's like, oh, now I can just drop into there because I'm not fighting internal resistance with maybe more of a weakened spot, right? Where I'm just in this like tug of war.
Yeah, yeah. I think it's so important. And for me, I am such into the hands-on release work and then letting the body, find its natural homeostasis
Mm-hmm.
after that. But I do have to say, in just talking with you and Sarah over the years, I've really been incorporating more of the strengthening components of the muscles that are weak. I had an experience myself. My right SI kept acting up. And I was working out one day and I just happened to lay down on the ground on my belly. And I was laying there and I just did a extended leg lift. And on
Mm-hmm.
the side where that SI joint was painful, that upper hamstring was so weak.
Oh yeah, you're like,
Uh-huh.
aha.
And so I'm like, oh my gosh, I need to do more of these. And I tell you, if that has not changed my pain in my SI joint by just
Isn't that
that,
hilarious? Yeah,
there's always something, everybody. And so we need to be the detectives, whether we need to be releasing tissue, whether we need to be strengthening tissue. It's a both and situation in the
for
body.
sure. It's been
Yeah.
a very interesting transition because when I was working in a clinic space, I was a very hands-on manual therapist, and like my hands were my extra, like how I assessed what was happening in people and getting things to let go and blah blah blah. But then when I went virtual, my hands are tied behind my back, so it really forced me to increase my observational skills, my movement understanding, and so it's pretty fun to have, people do a range of motion something on a call, get them to do an exercise, redo the range of motion, and it improves and it feels like magic, where you're like,
Yeah.
I didn't even touch you, and so then it's like there's still obviously a time. Sometimes I'm like, if I could only reach my hands through the screen and, do what
Yes.
I want to do kind of a thing. But I
Yeah.
think that like it puts so much more ownership into the individual to actually like feel the movements themselves, but then also gets more of that holding power to the movements. However, sometimes we need to set the stage, knock a little rust off, add a little bit of awareness, hands-on, I mean, connect with the patient, right? There's so much that goes on with like that hands-on touch kind
Yeah.
of component to it. But it was fun too to work with. There was another therapist that I worked with that also was a very hands-on therapist, and I was having to like fade out of the clinic because it was just wearing down her body. And so she then did our courses and has been gotten better at like the movement component piece. And she's like, yeah, like I'll do like 5 minutes of manual and then it's all exercise. She's like, so now I'm able to be a clinician like I want to be because
Yeah.
I can save my body and make them do more of the work in a sense.
Yeah, yeah. Well, it can be a beautiful balance doing both. So
Oh, for sure. Yeah.
yeah, awesome. Well, and what I want to say to everybody listening to that comment is go where your love is, you know?
Oh, for sure.
And,
Yeah.
and like I love the hands-on. I like am addicted to feeling the release, and yet I am appreciating more and more the exercise component of it and making sure that I bring that in to my sessions. So
Well, and realizing you don't have to do it all, right? Like you can be a team, it's like if someone's going to be like people would, if you have someone in your network that's really good hands-on or, whether they're a PT massage therapist, whatever, it's like, cool, go see them, let them do their magic. Now come see me. And we can then focus on, because you only have so much time in like each
right.
session, right?
Yep.
So then
Yep.
you can kind of have this whole like team there to support you, which obviously can be challenging, scheduling, finances, all that kind of stuff. But in the end, I think that you get more bang for your buck because you're getting that multi-prong approach for moving
Yeah.
forwards.
Well, and I think everybody benefits when we stay in our zone of genius.
For sure.
So know what yours is and own it is what I
Yeah.
would those
Yeah.
listeners here. So awesome. Anna, this has been great. Thank you so much for taking the time to
Yeah.
share your wisdom with us again. And I just want to encourage everybody, if you haven't already listened to Anna's interview, it's already gone live by the time this podcast is being released. So make sure you check it out and purchase the lifetime pack so you can go back and listen to it again because there's a lot of juicy nuggets in that interview that you'll want to make notes on and really start integrating into your practice. So
Yeah. And all the great bonus material that comes with it as well, and starts to give even more thoughts of this dabbling of movement ideas to support the actions.
awesome. Awesome. Well, thank you everybody for listening in, and we will see you all in the next episode. Take care, everybody. Bye
Thank you
bye.
so much.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm I'm Lynn Schulte, founder of the Institute for Birth Healing.